Applying the correct technique when lifting and handling loads can significantly reduce the likelihood of manual handling injuries such as musculoskeletal disorders. There's a 5-step guide to good handling techniques for the lifting and lowering of loads that employees involved in manual handling tasks should follow. The first step is to plan for the lift. To do this, think about the task ahead. Examine the entire path of travel, ensuring you're familiar with the terrain and that it presents no avoidable obstacles. Also, examine the object to determine whether you have the capacity to safely lift it or whether another team member or mechanical assistance is required. The second step is to position yourself correctly for the maneuver. To do this, get as close to the load as possible, then position the feet shoulder width apart with one foot slightly in front of the other. If the weight of the load is uneven, it's recommended that you place the heaviest side closest to you. The third step is to lift the load. While lifting, keep your head up, bend at the knees, keep the load close to you, preferably with elbows bent. Ensure a good grip on the object and use your legs to lift while undertaking the action smoothly. The fourth step is to move with the load. While you move, try to walk straight to avoid twisting the body or making sudden movements. You should keep a clear view ahead and keep the travelling distance as short as possible. The fifth and final step is to lower the load once you reach the drop point. While lowering the load, use the same movements as you did to lift, but in reverse. And be aware of the risk of crushed injuries to your fingers and toes.